Hello, I'm Dr. Sindhu and I'm going to start Saudi license exam MCQs. These are recalls. So let's start from the question number 1. Okay. A 15-year-old child presents with severe pain and deafness in his left ear for 2 days. He is febrile. There are hemorrhagic blisters on the tympanic membrane extending along the external auditory canal. Okay, and so there are a history of blisters, tympanic membrane to external auditory canal, and severe pain and deafness. Okay, and so what is single most likely diagnosis? So it's varicella and Merz-Spiram-Sehan syndrome. Okay, so varicella is fixing here, so it's number E. Okay, number 2, 20-year-old unmarried woman presents complaining of severe dysuria, fever, vaginal discharge, and vulvar soreness. She had casual sexual intercourse 2 weeks ago. You find a profuse discharge with redness of the vulva, which is the single most appropriate investigation. Select one option only. Okay, so here we'll go for a gram stenoff vaginal discharge. Okay. Okay, so she has presented with gonorrhea, okay, and she has dysuria and urethral discharge, okay, and female cervical vaginal discharge, okay. So gram stent will show gram negative diplococci. Okay, and its treatment is ceftriaxone 1 gram IM. Okay, but if a patient don't want injection, then you can prescribe capsule cefixime 400 mg single dose. Okay, and you can prescribe a single dose of ciprofloxacin 500 mg. And if patient is allergic to penicillin, and then you can give 2 gram azithromycin single dose. Okay, so now come to the question number 3. Okay, a 50-year-old asymptomatic man attends for a routine health examination. The ECG reveals lone atrial fibrillation with a rate of 74 per minute. All other investigations are normal. What is the most appropriate treatment? Select one option only. Okay, and so his heart rate is 74. Okay, and rest examination is normal, so you can give amiodarone. Okay, he's hemodynamically stable. Okay, question number 4. Okay, a 38-year-old woman attends for antenatal booking at 15th week's gestation. This is her first pregnancy. She requests the most reliable perinatal test for Down syndrome. What is the most appropriate test? Select one option only. Okay, as for Down syndrome, 15th, she has presented on the 15th week of gestation. So you'll go for amniocentesis and chromosome analysis for Down syndrome. Okay, now comes to the, now it's about osteoporosis. 50-year-old woman had an early menopause following treatment for breast cancer. A bone density scan has revealed moderate osteoporosis, which is the single most appropriate treatment. Select one option only. Okay, yes, her age is less than 65 years, and so but she has been through chemo radio for the breast cancer. Okay, and she is more prone. So we will prescribe bisphosphonate with calcium and vitamin D supplements. Okay, and we'll ask her to take bisphosphonate the empty stomach with 1 glass of water in the sitting position, and keep walking for 1 hour. Otherwise she'll develop esophagitis. Okay, question number okay, I'm not talking about the questions because it's like not in accordingly, like from 1 to 5. So I'll just keep revising. Okay, 12-year-old girl presents with high fever, vomiting, malaise, headache, and potophobia for 24 hours. Her temperature is 39.6 with irritability, neck stiffness, a positive chronic sign, and generalized patchy. Which is the single most appropriate drug to administer parenterally before admission to hospital. Select one option only. So in a GP clinic, you will prescribe benzyl penicillin. Okay, IM only. You will administer benzyl penicillin IM state, and then you'll refer patient for hospitalization. Okay, a 60-year-old woman with okay, so she has meningitis. Okay, and okay, that's it. A 6-year-old woman with meningococcal meningitis. A 6-year-old woman with a carcinoma of breast and widespread lung secondaries has a trouble some cough which is keeping her awake at night, which is the most appropriate medication to prescribe. Select one option only. Okay, and so she is a patient of carcinoma and with metastasis. Okay, so we'll prescribe morphine. Okay. Question number 10. 45 years old man presents with a pustular eruption on his cheeks, nose, and forehead, and blepharitis, which is single most appropriate treatment. Select one option only. Okay, 45 pustular eruption on his cheeks, nose, and forehead, and blepharitis. Okay, so oral oxytetracycline. Okay. A 34-year-old woman present with fatigue, insomnia, and low mood for 4 weeks. She denies a serious suicidal intent, which is single most appropriate treatment. Select one option only. So as she is 34 years, so we'll prescribe fluoxetine SSRI. Okay, is the first line. 50-year-old man with known COPD has a persistent cough, hemoptysis, and weight loss for 8 weeks. His chest X-ray shows shadowing in the right upper zone, which is the single most appropriate diagnostic investigation. Select one option only. Okay, and so CT scan, chest, okay, HRCT, to exclude any malignancy. 40-year-old woman complains of incomplete right-sided facial weakness and difficulty with closing her right eye for 5 days. This was preceded by pain around the ear, which is the single most appropriate treatment. So prednisolone in high dose. Okay, in Bell's palsy we prescribe 30 mg for 6 days, and then we titrate and we complete course in 10 days. Okay, but in Ramsay Hunt we give double dose. Okay, so prednisolone. Okay, corticosteroid. 30-year-old woman who is 8 weeks pregnant presents with symptoms of severe depression. She is very anxious and finding it difficult to cope with the single most appropriate treatment. Select one option only. Okay, so again 34-year woman, 8 weeks pregnant. She's 8 weeks pregnant. Okay, symptoms of severe depression. Okay, so you can go for SSRI, fluoxetine. Okay, if there was option of sertraline, then that would be best option. But it's not here, so you go for fluoxetine. A 24-year-old man attends with his wife, who reports episodes of bizarre behavior. He complains of an unpleasant smell and feeling nauseous. He then appears to lose awareness for a minute. He stares, lifts his right arm above his head, and makes chewing movements, which is single most likely diagnosis. It's temporal lobe epilepsy, bizarre behavior, unpleasant smell, and feeling nauseous, and lose awareness for a minute. Okay, and he stares, lifts his right arm above his head, and makes swing movements. Okay, so it's a form of epilepsy, so temporal lobe epilepsy. Abdominal pain, MCQ on abdominal pain. A 50-year-old man presents with severe pain in his left upper abdomen and back for 5 days with a high fever and rigors. His temperature is 38.5 centigrade and he is tender in his left line. Urine depistic is positive for protein, blood, leukocytes, and nitrates, which is the most appropriate treatment. Select one option only. So, cephalexin. Okay. A 3-week-old boy attends for a routine neonatal checkup. He has a positive bilateral orthogonally maneuver test, which is the most appropriate next management steps. Select one option only. So arrange an ultrasound of both hip joints. Okay. And to exclude dysplasia, hip dysplasia. 50-year-old man with diabetes and hypertension complains of central chest pain while working this morning. The pain lasted 10 minutes, was relieved by rest and had not occurred before. Examination and resting ECG are normal, which is the single most appropriate investigation. Select one option only. He's non-diabetic and hypertensive, and he presented with central chest pain while working this morning, which lasted for 10 minutes and relieved by rest. Okay, and he didn't had such type of pain before. Okay, and so single most appropriate and next investigation will be EET, exercise electrocardiogram test. Okay. 55-year-old woman with hypertension and ischemic heart disease complains of disrupted sleep for the past 3 months. Her blood pressure is well controlled. She takes the drugs listed below, which is the most likely drug to cause her symptoms. So atenolol. Okay. A 6-year-old boy presents a 16-year-old boy present with abdominal discomfort, tenesmus, and severe bloody slimy diarrhea for 2 days after returning 10 days ago from a rural village. He is aparaxal and there is no significant clinical abnormality, which is the single most likely diagnosis. Select one option only. So, as he has presented with abdominal discomfort, tenesmus, and severe bloody slimy diarrhea, and there is history of to rural village, so it could be amoebic dysentery. A 10-year-old girl presents with 1 week history of rash on her trunk. It began as a single pink scaly well circumscribed area and spread to cover her trunk. There are multiple pink oval scaling lesions which follow the lines of cleavage of the skin and are itchy, which is the single most appropriate management option. Select one option only. So she has presented with a 1 week history of rash on her trunk. It began as a single pink scaly well circumscribed area and spread to cover her trunk. And there are multiple pink oval scaling lesions which follow the lines of cleavage of the skin and are itchy. So it is pityriasis rosacea. Advised that it is a self-limiting condition. Okay, you can also remember it by pink scaly well circumscribed pink rosea, pityriasis rosacea. Okay, pink. 65-year-old man with carcinoma